All right, good afternoon, everybody. Thanks for coming out. As always, I am Joe Crum, and today I'll be talking to you briefly about the benefits of marijuana reform, specifically when it pertains to federally legalizing the use of recreational marijuana. Next slide. So, everybody knows that drugs are bad, right? Drugs are bad, okay? We've been taught that since we were kids. It's been harped on in cartoons like South Park, Family Guy, some other ones specifically with the DARE program with high school and middle school students saying that drugs are bad. And the biggest proponent of that, or the biggest misperception of that, is that marijuana is a gateway drug. So marijuana, in fact, does not make you do meth, cocaine, heroin, or some of the harder drugs. Next slide. So just to kind of preview what we're going to talk about, we're going to talk about how to do it the right way, the war on drugs, and of course the medical benefits of smoking, not necessarily eating marijuana. Next slide. All right, so how to do it. So there's several states that have already recreationally legalized the use of marijuana. Colorado and Washington were the pioneers. In 2014, they both legalized the use of recreational marijuana, and as of 2018, around the beginning, California did as well. And I bring these three up because of the revenue that they've generated. In the instance of Washington and Colorado, is at probably about $1.6, $1.7 billion since they started to sell. And for California, it has reached $2.6 billion with 1 year of taxable revenue that is in turn being used to support programs like Medicaid, healthcare for the elderly or the poor, as well as the education systems in Washington and Colorado. It's too early to tell what California is doing with this money, but following suit and seeing how states like Colorado, Washington, and Oregon are doing it, it's safe to say that they will likely use it to fund their healthcare system as well as their education. Next slide. All right, so talking about the war on drugs, everybody knows that marijuana has been criminalized for the last 60 plus years, specifically when it comes to the possession of marijuana and the correlation between smoking marijuana and poorer individuals, whether it's racially profiling or bringing it back to just the average user of marijuana. So some highlights that I wanted to talk about from the war on drugs is that since it started, the taxpayers have spent, or the government has spent over $1 trillion on the war on drugs. So you can kind of see that given that number and the ineffectiveness of the actual war on drugs, because people still use marijuana, it's still being purchased illegally in a number of states, and it's still, and it's on the agenda of everybody to decriminalize marijuana so it can be purchased legally. Why are we still spending this much money on trying to stop people from smoking it when it's been legalized recreationally in 12 states, medically legalized in 30, and then is on the books to be legalized federally? Just one last point I wanted to hit on the war on drugs. In 2017, there were 600,000 instances of users being arrested solely for the possession of marijuana. This is taxing our court systems, it's taxing the prisons, and it's taxing our jails. So we're spending an inordinate amount of time and money on users of marijuana when it's not that big of a deal, and it's something that is on the agenda for both Republicans and Democrats to decriminalize. So I just wanted to emphasize the fact that it's still flooding our jails, prisons, and our court systems, and that is a significant amount of money being spent annually by the U.S. taxpayer. Next slide. So, looking at the benefits of marijuana. So, the thing about marijuana is that it is an alternative to opioid-based drugs. And if you have been following the trends in the last 2 to 3 years, opioid-based drugs are on the rise. So we're talking about illegal purchase of Percocet, hydrocodone, and painkillers that are being sold illegally, smoked, and have been laced with other opioids like fentanyl that are infinitely more lethal than smoking or ingesting marijuana. The other unique aspect of marijuana is that for those addicts who have become addicted to opioids, they're using marijuana to curtail the effects of withdrawal. So in line with cancer and terminal illnesses, chronic pain, and now supporting or in the use of the withdrawal process of opioid addiction, they're using marijuana now both medically, and making that more accessible to people will help in the long run. Next slide. So in review, we've discussed how to successfully implement marijuana reform at both the state and federal level, the war on drugs, and the medical uses to date. Next slide. Are there any questions? All right, pending any questions, thank you all for your time. And